Eric, you had me in the first line of your opening piece in this series where you said, follow the pills and you'll find the overdose deaths. Give us an idea about the havoc that these overdose deaths are causing in communities in West Virginia.
Well, they're ravaging families, they're destroying communities. We have the highest overdose death rate in the nation due to drug overdoses. And just if you look in southern West Virginia, which is our coal region, there's tremendous overdose death rates there. The top 4 counties in the nation for drug overdose death rates are all in West Virginia. In the top 20 counties in the United States, at least 11 of the counties are in West Virginia, primarily in southern West Virginia. So it just had a tremendous toll on law enforcement, on the hospitals. It's torn families apart. It's really been devastating.
And what was it, I know you're a state reporter, state house reporter, what was it that made you want to focus particularly on this issue?
Well, I started out because I covered the Attorney General's office, and we had a new Attorney General elected, and we found out that there was a lawsuit that had been filed prior to him being elected in 2012, and that lawsuit was against drug wholesalers. And so we started looking at his ties to that industry. It turned out that he was a former lobbyist for the drug wholesale industry, and his wife was a lobbyist for one of the largest drug wholesalers in the country. From there, we looked at a lawsuit that had been, the one I mentioned, that had been filed in 2012. And there were parts of the lawsuit that were filed under seal, and we were really surprised that we couldn't get access to that. So we had to actually go to court, and we had a big court battle with the drug wholesalers, but we ultimately prevailed and were able to unseal the records.
Yeah, tell me about that. I'm curious to know what it's like for you to be taking on these drug wholesalers, because they are massive, multi-billion-dollar companies. Here you are working for a relatively small newspaper. What's it like to go up against these people?
That's one thing I didn't know before I got into this, the size of these companies. So just to set the scene, we would show up. The lawsuit was actually filed in a small rural county in southern West Virginia, and we'd show up in the courtroom. We had 2 lawyers. One was from West Virginia University, and the other was from the town that the suit was filed in. And they were up against probably 20, 25 lawyers, all flew in from Washington, D.C., from the corporate headquarters of these companies. So it looked like the deck was stacked against us, but we have real good lawyers, and we were able to prevail.
Well, it's incredible, and your stories really reveal how these drug companies turned what looked like a blind eye to the suspicious sale of these drug orders and profited from the epidemic that you've told us about. I wonder what was the reaction like in West Virginia once your articles actually went to press?
Well, the first thing that happened was they started tracking what's called a suspicious order. And that's when a pharmacy orders an extraordinary number of drugs, either over a short period of time or a massive quantity all at once. About 2 weeks before this story ran, I went and asked them to look at these suspicious orders for drugs. They just brought them out in 2 bankers' boxes. They hadn't counted them. They had lost, for one company, they had lost upwards of 8 months' worth of reports from one company. And I asked them, what are you doing with these reports? And they said they weren't doing anything with the reports.
Unbelievable. Oh, you've certainly brought a lot of attention to this now. The Pulitzer Prize brings even more attention to this now. Where do you want to go next with this story?
Well, I'd like to do a couple things. One is to look at the various treatments options, but I also, as I heard in the opening segment, as you know, there's been a real switch, and that switch is to the heroin and the fentanyl and the carfentanil. For the first time, last year heroin was the #1 overdose killer. We have fentanyl now is #1. So I really want to kind of really look at that issue, the fentanyl and the heroin.
Well, Eric, you've shine a light on a huge problem, and that exists both in Canada and the U.S. Congratulations to you and for your success on this story.
And thank you for bringing attention to the issue.